Hi everyone, John Benko here. I'm the Director of Nursing on Belfair's campus here in Shaker Heights, where today, which is the 24th Friday of July, my temperature was 98.5. I know that because I was screened, just like all of you were screened. I'm just bringing that up because we're keeping up our precautions. Please do that. You see, I don't have a mask because I'm in a room by myself, but if you're anywhere else and you're in the state of Ohio or anywhere in the world, you should be wearing a mask. Recently, here on campus, we were deploying the N95 type mask because we had some exposures. We're rolling back from that a little bit. Most of the quarantines have been lifted. V building, I think, will stay in that for a little while longer till that expires. But everyone else, starting Monday, will start to be issued isolation or surgical masks, and we'll be doing those as a daily use. If you have any questions, look to your supervision. They're aware of this, and we'll be getting those masks out to you. Again, I'm happy to report we have none of our residential clients here in the Belfair system ill. Same with Applewood. We are quite fortunate, and most of that is due to your hard work to make sure that we're keeping these precautions up and keeping our children safe. As we find out new data, we get it out to you. If there are cases or exposures, you'll always be notified. You'll be notified by your supervisor if there's been a potential exposure to you. You'll also typically be notified by the Department of Health if they think so. If they think that it's appropriate to reach out to you because you may have been exposed. We have been working closely with the Cuyahoga County Board of Health. We're also talking to the, of course, other health authorities and health providers in the area. So they know what we're doing, they know how we're doing it, and they have been very supportive, and we're lucky to have them on our side. So things are going as well as we can expect them. We're going to ask you all to stay hyper vigilant. We'll be opening schools soon, and we know that we've got some plans in place for there. But essentially what we're trying to do is keep us all healthy. We will do that by following those protocols, right? We're going to clean up. We're going to make sure that all of our areas are sanitized. We're going to do good hand hygiene. We're going to keep distance between us whenever we can. And we're going to mask up, right? We got to make sure that we're wearing our masks. I do want to point out that we've got some data coming out from the healthcare environments. We're finding that what we're seeing, the greatest transmission is adult to adult, either at home or occasionally in the workspace. And what we're seeing in the workspace was a little disheartening. We're seeing that we're doing great when we're out in front of patients. We're masked up. We're following all the precautions. Then we take our break, and we unmask ourselves, and we get close together, and we engage in high-risk activities and get each other sick. So high-risk activities include eating. So when you're eating, we want to make sure that you're doing that safely. You have to take a break. We want you to eat, and we want you to eat healthy, and we want you to do it safely. So when you're eating, right, you don't have your mask on, you're chewing, you're putting food close to your mouth, you've got a lot of saliva going. You need to be doing that by yourself. You need to be distanced from people. There needs to be a barrier around you so that you're not taking that chance of spreading any possible communicable diseases, namely COVID-19, right? So keep that in mind, all right? We got to eat in shifts. We need to spread out a little bit. We've got a lot of picnic tables here. That'd be great if you want to have some good social time, but stay 6 feet apart. Try not to be facing each other when you're eating, and just be careful. We'll continue to follow all the guidelines and guidance that we get from all of our partners in the local healthcare communities and with those health authorities. And I hope that we keep doing well. We're all doing a great job, and I appreciate your efforts. We want to make sure that we are covering up, right? We're wearing our masks. We want to make sure that we are washing up, right? We're keeping our areas clean in our hands, and we want to back up. Let's get that physical distancing. That is helping. Facilities will continue to make sure that we have everything we need. We may be seeing some adjustments in the physical workspace. Be patient, and please be flexible. Things will be changing. You may see brands change. You may see the way things look change. So the wipes you're used to getting may be different wipes. We may switch to some spray instead of wipes. Please know anything that's being provided for you has been vetted, and it is an appropriate use. So it's up to you to use it appropriately, but it's also up to us to provide it. So the agency has done a great job making sure that you're getting what you need. So please don't be concerned if things look different. Just know the facilities has got the right thing for you, and it's exactly what you need to do the job. We are managing many of our things through the Strategic Stockpile, the SSP committee and program, where facilities works with safety and security, and I'm on that committee as well, and we make sure that you get things, and we keep a tight control on things that we use a lot of that might have a limited supply. As supply gets better or needs goes down, those will go back out into the supply chain, so you'll get a hold of those through work orders. Look for communication. Help your teams understand this, right? If we need it to be strategic, we will keep it strategic. If we can get it out through local channels, we will. We're doing everything to make sure that you get your supplies as quickly and as unobstructed or uninterrupted as possible. We'll see shortages from time to time, but we'll manage them just as we have been. So that's all I have from you. There wasn't a lot of information, but I wanted to touch base. I'll try to do this once a week. I know we've fallen off because there isn't a great deal of information. Some of the information we do have that is great is, yes, numbers went up, but they're leveling off a little bit. They're still too high. So we've got to be cautious. What we're finding is when people are getting sick, it's not as serious as it was originally. Some of that is because we understand the disease better. We have better controls in place, and people are working harder themselves, right? We know how to isolate ourselves. We know how to take precautions. So keep that up. As guidelines change, we'll get them out to you, but we need you to be flexible and we need you to be vigilant. So keep doing it. As I always say, if there's anything I could do to help you, you can reach out to Benko J at wingspancg.org. You can reach out there if you need some help contacting the Employee Assistance Program, or reach out through your supervisor or HR. If stress is getting to be too much, please get some help. If you can help somebody else out, do that. Please spread kindness, not virus. And in the meantime, if you need something, reach out. If not, I want you to please be nice to each other, wash your hands, and stop touching each other. Have a great day. Talk to you soon.